DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson. Sure glad you joined us today. We're going to talk about bovine respiratory disease diagnostics with Dr. Dick Hesse, who's a professor in the diagnostic medicine and pathobiology department and the head of virology here at the Kansas State Veterinary Diagnostic Laboratories. Sure glad you joined us.
In the last 3 years, we've changed some things in our AI protocol, one of which was the use of multi-min. We've seen a significant increase in our AI pregnancy rate. The cost of an embryo program is significant, and we feel that if we were able to even get one more pregnancy out of a cow, that would pay for the whole cost of the whole bottle of multi-min right there.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold. Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Dick Hesse, who is a professor in the Diagnostic Medicine and Pathobiology department here, and you also are the leader or head of Diagnostic Virology. Yep. Here at Kansas State's Diagnostic Laboratory.
Veterinary Diagnostic Laboratory. Yep.
You bet. And so you're teaching, doing a lot of research, and you're doing a lot of service of virology and other things.
I get to play a lot. Yep. That's right.
Well, they say if you do what you love for your job, you'll never work a day in your life. So
I haven't worked since 1976. Kind of nice.
Yeah, you bet. Well, we sure appreciate you being on the show. We appreciate what you do for a lot of producers and veterinarians internationally, and you really do bring an international level of expertise to our diagnostic lab, and we're thankful that you're in Kansas.
Well, I really love it here. It's a great place, great people. Just everything about it is just really nice.
That's awesome. Well, today, I know you've done quite a bit of work with bovine respiratory disease, and so we're going to talk today to the people about respiratory disease, about what sets it up, how do we diagnose it, what are some of the tests y'all are doing in the laboratory. But let's start out with just what is BRD?
BRD stands for bovine respiratory disease, and actually you forgot one letter, BRDC.
C, complex.
And that's actually the key thing. This truly is a complex. There's multiple bugs, multiple agents, infectious agents, and stress that are involved. And that's why it's such a tricky thing to control. I mean, historically, these animals, they're assembled at the cow-calf area, and they're put together, brought in smaller groups into bigger groups, sold at sale barns, and then they're moved from a sale barn into a feedlot, and they're stressed all along the way. Well, there's a lot of normal viruses. That's what I concentrate on since I'm a virologist.
Right.
And we virologists always think that viruses are the thing that predisposes these agents or these animals to other agents, the other agents being bacteria. So the way we always think is the stress of shipping, followed by viral infection, followed by bacterial infection that usually will end up oftentimes killing an animal. So that's how we think it normally works.
So a lot of things is kind of similar to us. You get a cold, you don't take care of yourself.
Yep.
You wind up with a bacterial pneumonia type.
Yep. Unfortunately, human care is a little bit better than the feedlot care. A little bit.
Yeah. Well, we got a lot of people out there running around feed yards that would say, that there is a high level of care.
Right. Exactly. Yeah.
To these animals. But I think it's important that we understand that one thing leads to another.
Yep.
I always tell my students there's two reasons why animals get sick: overwhelming dose of a pathogen or a suppressed immune system.
That's absolutely right. And the two go hand in hand here.
We're glad you joined us today, and we'll see you here after the break.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
There's something wrong. His head is down. He's clearly stressed. He's worried sick about BRD. That's why there's prescription Zactran for BRD treatment and control in high-risk cattle. Get a rapid response plus 10-day treatment and control in a single dose, so you can stop worrying and get back to business. For use in cattle only, do not treat cattle within 35 days of slaughter. Because a discard time in milk has not been established, do not use in female dairy cattle 20 months of age or older or in calves to be processed for veal. The effects of Zactran on bovine reproductive performance, pregnancy, and lactation have not been determined. Don't worry yourself sick. Talk to your veterinarian about a real alternative for BRD treatment and control. Because it's critical, it's Zactran from Mariel, a leading animal health company.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Be ready for breeding soundness exams with Neogen's new and improved ElectroJack 6. Features a new wireless design, improved waterproofing, and more power for quicker and easier collections. Its newly designed probe features a tapered angle for easier insertion, and new rubberized material adds durability. ElectroJack 6 can be used with rams, boars, and bulls of all sizes. To order or for more information, contact Neogen at 800-621-8829 or your local animal health distributor.
This segment is brought to you by Double D Family Mat Shop. Injured livestock could mean injured profits. Protect yours with no-slip mats from Double D Family Mat Shop.
Hi there and welcome back to DocTalk. Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, joined by Dr. Dick Hesse, who is a professor in diagnostic medicine and pathologist and the head of the diagnostic virology at the Kansas Veterinary Diagnostic Laboratory. And we were talking about bovine respiratory disease complex.
Yep.
And the stress part of it, we see cattle, the stress of maternal separation or weaning, long transportation, co-mingling, weather, people, cattle interaction, all these things can cause stress, which when we have stress, we suppress the immune system.
Yep, absolutely.
And then that leads way
That's
to what you
for the
studied.
viruses.
That's right. The virus. Here we go. We got to the viruses.
So then we have quite an array of viruses that like to get in, do their thing.
What are some of those that are associated with respiratory disease?
The biggest one that I think of right away when I think of shipping fever, that's the old name for bovine respiratory disease complex, would be IBR, infectious bovine rhinotracheatis. It's a herpes virus. And that's a primary pathogen. I could do a pretty good number on the animals when they become infected with that. So then IBR, PI3, parainfluenza 3, that's another respiratory virus. That one's not as big a pathogen anymore as it used to be. PI3, BVD,
you bet.
Bovine viral diarrhea. That's the one I really pay attention to. It has a much bigger role in respiratory disease or in disease in general for all cattle.
Right.
It crosses the
very
line
immunosuppressive, that virus.
Very, probably the most important cattle virus ever.
Right.
Short of a foreign animal disease virus.
Kind of like PRRS in pigs and BVD in cattle.
Exactly.
Yep.
It's a very, very nasty virus. Other respiratory viruses that we know of would be BRSV, bovine respiratory syncytial virus, kissing cousin to human respiratory syncytial virus, and that's a bad pathogen in humans. It can cause significant disease in cattle as well. And probably the more recent one that we're seeing has a lot of involvement in respiratory disease is bovine respiratory coronavirus. We always used to think of that as an enteric or a virus that caused diarrhea.
Yep.
Yeah. Well, we're seeing a lot in bovine respiratory disease complex, just all over the board. And actually, in recent times, we've isolated some of these viruses and sequenced them, and there looks to be a couple different types of the coronavirus.
Okay, that's what I was going to ask you. Is the same one that causes the diarrhea, can it cause respiratory disease or vice versa?
We think so. Actually, we know so. But even within the respiratory viruses, there seems to be some clades that are breaking out that are different.
Okay.
And we're just finding that out. This is within the last 6 months.
Different types of coronavirus, and we know that there are different types of...
different strains, if you will.
And same with BVD.
Yep.
Type 1 and Type 2, and then...
1A, 1B, 2A. Actually, we just found our first 2B virus just within the last 2 weeks.
It's pretty fascinating what you do.
Pretty cool stuff, yeah. It is.
When we come back from break, we're going to continue our discussion on bovine respiratory disease complex with Dr. Hesse. We're sure glad you joined us.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi there, it's Dr. Dan with an on-the-farm tip. Today we're going to talk about receiving pen management for those high-risk calves. Nothing aggravates me more than to have a load of calves come into a feeding facility and our receiving pen is not prepared. What I'm talking about with preparation of that pen, first of all, is cattle comfort and a place to lay down. If there's mud in the pen, we want to make sure we take the box blade one lap, give those cattle a place to lay down, or supply bedding. Another thing, a tip that we need to make sure we provide ample water supply and make sure that we have good long stem hay in the bunk for those calves. That's your On the Farm tip. I'm Dr. Dan, and thanks for joining us.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300 LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300 LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300 LA is the practical choice for your herd.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome back to DocTalk. I'm joined once again by Dr. Dick Hesse, who's a professor in diagnostic medicine and pathobiology and the head of our virology department here at the Veterinary Diagnostic Lab. And we've talked about stress, setting these calves up for a viral infection, and those viral infections can be a primary pathogen or they can be immunosuppressive that lead into bacterial secondary invaders.
Especially BVD.
BVD,
yep.
and we wind up with bovine respiratory disease complex. Well, what are those bacteria that you're looking at?
So the main bacteria that we see, especially in animals that die, are going to be Pastorella multocida.
Yep.
Mannheimia.
Yep. Hemolytica.
Yep. Mannheimia hemolytica. Histophilus.
Yep.
Those are the three biggies that we see in dead animals. But oftentimes, we're also going to see mycoplasma.
Sure.
Mycoplasma bovis. And up until recently, we kind of just poo-pooed that as, it's there, but it's not really doing anything. But with some of our newer assay systems, we're actually to look at how much of that agent is in the lungs of dead animals. There's a lot there. So its role is probably changing or has been bigger than what we gave it credit for in the past.
Sure.
But by far, the biggest one is Mannheimia.
Yep. And for people who don't recognize Mannheimia hemolytica, that's used to be named Pastorella hemolytica.
Right.
For us people that studied that before the name change.
Those bacteriologists are always changing the names.
I know.
We virologists keep the same one.
Well, I wish they'd keep the same ones for bacteria too. So okay, now I have, I need to get samples to you at the diagnostic lab. What, I'm going to involve a veterinarian. We always recommend the use of a local veterinarian in a case like this. But what are veterinarians going to take? And let's start out with the live animal as far as samples.
Live animal, the easiest sample and probably the most important, obviously the most important sample is a nasal swab.
Okay.
And, good, deep installation of the swab, swirl around, get a good collective sample.
I like how you use the example.
Yeah, you got to do it that way. Okay, and then you get the swab, but just as important as getting a good swab sample is putting it into the transport media, breaking the top off and sealing it and getting it on ice
Keeping it in the
away.
media so that you keep a viable sample.
And a proper transport media. The reason for that is then we can do PCR assays on it. We can also do virus isolation assays on it, and we'll have good quality.
What about the dead animal?
Dead animal, a good post-mortem is essential, and respiratory tissues. Those are the best things to send us.
So we want trachea, lung.
Lung is going to be your big one. That's where we'll make most of our diagnosis from.
What about blood samples?
Blood samples are good for monitoring serostatus of the animals.
Okay.
But at this point in time, since we're dealing with tissue samples, that'll just tell you what the animals have been exposed to or vaccinated for.
So on the live animal, we're looking at deep nasal swabs and proper transportation in the media. And on the dead animal, the big one's getting that lung tissue.
Yep.
And getting that to you so that you can run your tests.
Right.
Now we're set up for the last segment. When we come back, let's
Okay.
talk to them about what's going to happen when it comes to your laboratory.
We have some new exciting assays that I'll be talking about.
Thanks for watching DocTalk. We'll be back after the break.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
This is Agriculture Today from Kansas State University. The College of Agriculture at K-State has just set another record for enrollment, over 2,500 undergraduate students. This continues a strong upward trend. The student numbers in the college up 33% over the past 5 scholastic years. Kansas State's Don Boggs.
Macroeconomics of the ag industry, especially in related to other industries being more in a recession or down economy, and the ag economy has been very good. There's no doubt that the ag economy, but also just the food industries in general, and food science is one of the places we've seen quite a bit of growth in the last few years. Even in a bad economy, everybody keeps eating, so our students have been able to find good opportunities, and so I think it's led to more students.
This is K-State Research and Extension.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
If our local animal agriculture industry disappeared, what else would disappear? The buses that get us to school? The playgrounds and ballparks we go to after school? The books and computers that help us learn and grow? Animal agriculture provides millions of dollars in tax revenue that pay for our school improvements, that pave the foundation that will build our future. A message from U.S. soybean farmers and their checkoff.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Baytra 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis and high-risk cattle. Ask your veterinarian about Baytra 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Baytra 100, right the first time.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, joined by Dr. Dick Hesse, who is a virologist and professor in the Diagnostic Medicine and Pathobiology Department, and you are the head of the virology section, the veterinary diagnostic virology section here at our diagnostic laboratory in the veterinary college.
Right.
Talking about bovine respiratory disease complex, we've had everything from what causes it to what samples to take in a live or dead animal. Now the samples are coming to your lab. What are you going to do with these samples?
So we have a couple of really cool assays that we're going to run the samples through. Probably the most the newest one and the fanciest one, if you will, is this bovine respiratory disease panel. We're actually looking for the presence of the nucleic acid of these different viruses in the swab samples or the tissue samples. And that's known as PCR, polymerase chain reaction.
Yep.
And we can actually identify and quantify the amount of nucleic acid in the sample type that we get.
So you not only know which bug it is, but you know if it's a heavy growth or
exactly
a bunch of the
and
viruses.
That really helps as far as giving a good diagnosis as far as what's going on. That particular assay comes out of our molecular diagnostic group, not our virology group, but we work very closely together to develop those assays. Oftentimes, we'll take PCR positive samples and then they'll come into my shop and we'll do virus isolation on them and actually isolate the virus and then take it to the next level where we'll go in and sequence the virus so we can know how different. BVDs, is it a 1B, is it a 1A, 2A?
Just gives you more of a understanding of what's going on and
exactly. And then what we'll do is relate that back to vaccines and what's out there in the vaccines. Is there coverage of the vaccine strain to what we're seeing in the field?
And then on the bacteria side, you do the same thing, only it'll be with the antibiotics. Which antibiotic is the bacteria susceptible to?
Yep, exactly.
I never thought of it that way, where the virologist side of things is going to help direct you on the vaccines, and the bacterial side of diagnostics will help you pick out the right antibiotics.
Absolutely.
Pretty cool.
Yeah. Well, my nature is pretty dynamic. She changes the rules every day.
You bet. And so it's going to come in, and you have the multiplex PCR. I assume you're going to do some bacteriology.
Yes.
A growing of the bacteria that are present in the lungs.
That goes to the BACT group, as you said. They're going to isolate the bacteria, identify it, and then run antibiotic sensitivities.
And so it's either going to be susceptible, intermediately susceptible, or resistant.
Yep.
And resistance means it doesn't work.
Exactly.
You guys do some pretty cool stuff, don't you?
It's really a fun job, and yeah, we love it.
Well, I really appreciate you being on the show today and sharing with us this information. It's been a great day.
Well, thank you very much for having me.
And we appreciate you watching DocTalk. Remember, if you want to know what Dr. Hesse and I do here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Remember to always work with your local veterinarian, and thanks a million for watching the show. I'm Dr. Dan Thompson here from the College of Veterinary Medicine. You've been watching DocTalk. We're sure glad you joined us, and I'll see y'all down the road.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
We've been here for 42 years now. We run around 2,500 cows. I bought a couple loads of cattle out of cows, black cows out of California. I noticed these cows are kind of a off-color, rusty color. We're going to be processing these cows in the next few days, and at that time I will inject Multimin into them to help take care of their copper deficiency. I would recommend Multimin to any cow man, and it's been effective.